If you experience 15 or more migraines a month, you have chronic condition that may respond to an alternative treatment. June is Migraine and Headache Awareness Month, and here neurologist Dr. Kerry Knievel joins us live. She is the director of the Jan and Tom Lewis Migraine Treatment Program at the Barrow Neurological Institute. She's going to fill us in more on this chronic condition. Good morning to you, doctor.
Good morning. Thank you for having me.
Absolutely. I think that definition of 15 or more a month of a migraine is what defines it as chronic. How many people have this chronic migraine condition?
So 1 in 8 people have migraine headaches, and 1% of the population has chronic migraine. So 1% of people have headache on greater than half of the days. That's pretty staggering, and I think just really under-recognized as well.
Absolutely. I think it sounds awful. We have several people here in our office who have migraines. They're not considered chronic at this point, but how does it affect their daily lives? Because I see people who have a migraine who really can barely leave the house on those days.
Yeah, so that is the effect it has on many people. It really affects every aspect of their life. So their ability to work, their ability to care for their children, their families, to commit to social activities, even just to meet friends for lunch. The unpredictability of a migraine attack can be so debilitating in itself because you don't know when you can be a reliable employee, parent, anything. It's just very, very debilitating, and some people really can't get out of bed when they're stricken with migraine.
Do we know what causes them?
So we have some idea. We know that it's an overexcitability of the nerves, and sort of a predisposition for overexcitability of especially the sensory nerves in the head. And then people with migraine are more sensitive to triggers such as weather changes or stress or strong smells, or sometimes triggers can't even be identified.
So how do we treat this? Do we have to numb those nerves, or what do we do?
Yeah, you know, essentially there are many medications available for prevention of migraine and chronic migraine. One of the treatments that I use for prevention of chronic migraine is Botox. And it's actually injected in the face, the temples, the back of the head, the neck, and the shoulders. Typically the injections are done by a neurologist or headache specialist, and they're performed every 12 weeks for prevention of chronic migraine. It's a treatment that was approved by the FDA in 2010 for migraine prevention, but in chronic migraine only. So only for those patients with 15 or more headache days per month.
And we know a lot about Botox and kind of, you know, paralyzing those muscles. So it sounds like there's an overactivity there, as you sort of mentioned. What other treatments are there?
So with Botox, we're actually targeting the sensory nerves themselves. So although there is some effect on the muscles and the injections are done into muscles, we're really targeting the overactive sensory nerves with the medication. But muscles are actually injected, so there can be some side effects related to that. And in the clinical trials, the most common side effect was neck pain and some eyelid and eyebrow weakness. But if the injections are done very precisely, that's not seen very often in my experience. Other serious side effects can happen though, including difficulty with swallowing and breathing. But again, with the very precise injections, that's very unlikely to happen, and I've actually never seen it in my practice. So it's a very safe treatment overall.
Well, it sounds like that's why it's important to have a neurologist or someone who specializes in headache treatment do that procedure as well. Are there other options for people who suffer?
Certainly, yeah, there are other medication and non-medication options. For some patients, even identifying and avoiding triggers, if possible, can be very beneficial. Regular exercise and staying hydrated and sleeping the same amount and even at the same time every day. So going to bed and waking up at the same time every day is also a good way to prevent migraine.
And just stay away from weather, right? No, I'm just kidding.
Yeah, exactly. Easier said than done, right? And never get stressed.
Never, right? Ever, ever, ever.
No, just live on vacation. We all need to move to an island.
I am with you. I like you even more now. I love that.
Let's go.
Yes. Where can people find out more about these treatments so they can find a skilled person to help them?
So the website BotoxChronicMigraine.com is a good resource for finding a neurologist or headache specialist that treats migraine and chronic migraine. There's also information about Botox there, including the safety information and information about the medication.
Thanks so much, Dr. Knievel. We appreciate you joining us.
Thank you.